Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Now let's look into the autonomic nervous system, and this is on the heart. Now the ANS, that is the right vagus. So what is the effect of the right vagus? Right vagus, it causes the inhibits. It inhibits the SA node and then it decreases the heart rate. So SA node, when it is inhibited, it decreases the heart rate. Then comes the left vagus. The left vagus is nothing but it inhibits the AV node. Inhibits AV node. So right vagus, it inhibits the SA node, decreases heart rate, and left vagus inhibits AV node. So when it inhibits AV node, there is a slow AV conduction. Then moving on to the right stellate ganglion. The right stellate ganglion, it causes the stimulation of the SA node. So stimulates the SA node. Then it also increases the heart rate. Stimulates the SA node and the heart rate. So stellate SS, so it stimulates the SA node. Next is the left stellate. The left stellate ganglion is the effects is it stimulates the AV node. So stimulates the AV node. This is the left stellate, and this results in the shortened AV conduction time. So there is a shortened AV conduction time which is seen. To learn and grow daily like this, please do subscribe.